What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we're covering top questions patient ask X-ray techs. So to give you context, I'm a night shift X-ray tech, been doing it for about 4 years. So some of the more common questions we'll ask is it safe? And you almost try not to laugh because you're like, look, it's radiation. It can cause cancer. None of this is safe at all. But essentially, we have to explain to them what we're doing is willing to risk what, like I call it, like the risk for reward. Something is broken. We're here to do the X-ray, which hypothetically it can cause cancer. It can cause other stuff with it. But we're willing to do that because the benefits it has. So obviously we try to explain them how we mitigate the stuff and how we try to column it and try to explain them a little bit just to keep them more calm. Mainly for like little kids or certain younger patients, they'll ask that. Or they'll ask the infamous, how long will it take for the report to come? And then it's always depending how busy it is, it's like, well, I've noticed if you just give them the general 30 minutes to an hour, that kind of works, but certain people are very, very picky with their answers. And technically speaking, if it's in-house, you could probably get the report as little as 5 minutes all the way to 30 minutes, probably. And then it comes down to the and then it comes down to the ER doctor to actually give the report to the patient. So it could literally be an hour and a half, even 2 hours, depending how busy it is. I've seen it because certain patients will get mad that we do the X-ray and then they'll complain that it takes too long. And I'll be like, look, as soon as I shoot it and I put it online, the rad can look at it, whoever is in the ER can look at it, and it's just, it all literally comes down to whenever they tell you the results. So there's that aspect of it. Some of the times they'll ask why we do certain stuff compared to other times. Like, for instance, sometimes we'll just do a 1-view chest X-ray. Sometimes they'll order a 2-view chest X-ray. So sometimes they'll ask you about that. Other times they'll be just genuinely curious, especially younger people, about the actual field. And you'll get some questions as far as like what you had to do for training or how school was like and stuff like that. So if you're in school, I wish you the best of luck. I remember those days. Pretty tough times. There's that. Or they'll ask if when you're doing, let's say, their chest, if you can also do their stomach because it hurts. And then you have to tell them, well, we only got a report for, the chest X-ray. If you ask your doctor, they can put a KUB if they think they need it, and then we'll come back and shoot it, because sometimes they think you can just shoot it just to shoot it. Unless you have a verbal order from a doctor, then you can do it. So you have to explain to them there's like a set way, a protocol and stuff, how stuff goes. Sometimes patients get worried about the dosage amount, because certain patients get a lot of X-rays versus CAT scan, and you had to explain them like the different dosages. Because if you're getting a bunch of CAT scans done, the dosage of a CAT scan is way more. I think it's like 100x of what a regular X-ray, or 1,000. I can't remember off the top of my head, but it's way more, significantly higher dose to get CAT scan versus a simple X-ray. So that may help you and help them like calm them down, because some of the patients do get a lot of X-rays, especially if they stay in house. There's been one time one patient had radiation burn. We never saw it, but that always curious me. I've heard of it and I've read in textbooks of what it was, but I never got to see it. So yeah, it's been your boy Miguel. I hope you learned something. I'm here to educate you in this beautiful field of radiology. And if you check out my channel, I post various aspects, both from school, both from in the field, and certain stuff that you can only learn here because no one on the YouTubes is doing it. And I'm here to educate y'all. See you on the next one.